Patients across the country continue to bear the brunt of the strike by doctors and nurses. We did a spot check around the country and the situation continues to worsen. At Mama Lucy Kibaki Hospital, patients were locked outside the hospital's gate. What is usually a very busy hospital serving patients from Nairobi County and its environs remains a ghost hospital as health workers downed their tools. At the gate, we meet Mary, who had brought her daughter. She's in labor as she writhes in pain outside the gate. She cannot afford 1,000 shillings to hire a taxi to Kenyatta National Hospital.
Tunakuja tunaambiwa hospitali haifanyi kazi, madaktari wamegoma. Na kwa saa hii kusema kweli mbele ya Mwenyezi Mungu sina hata ngururu. Labda ningefikisha kwa hospitali ndio niende baadaye niangalie vile naweza kupata pesa.
As we wait, a car is stopped at the gate and the driver is advised to find another hospital. We take a closer look and the patient inside is groaning in obvious pain.
Nini nimefanyika? Yeah? Wapi?
He is bleeding profusely and he is hurriedly driven away. Back to the lady in labor pains. We hire a taxi for her and we follow them to Kenyatta National Hospital where they finally get help. At Mbagathi Hospital, the situation is the same. The gates are locked and no patient is allowed in. Those coming out have saddening tales to tell.
Mgonjwa wangu nililetanga huku last week, akona wiki mbili huku. Pato hajapata nafuu. Na mpaka wa sasa mpaka vile walikoma wakaturuhusu tutoe bila kulipa bili. Na hata mpaka sasa nimeshindwa juu mimi ni mtu wa jua kali.
Wafula has to come and feed his wife since there is no one to do it. He says they were told to take their patients to other hospitals, but he has no money to go to a private hospital.
Madaktari hawako. Kuna daktari nilipata hapo jana mmoja, ndiye alikuwa anajaribu kushughulika lakini mpaka waleo hajarudi tena. Kumekimya hivyo tu.
According to the medics, there is no legislation established to oversee the transfer of their services to county governments in line with constitution. On Wednesday, the High Court issued a temporary order to stop the ongoing strike, pending hearing of an application filed by the Attorney General challenging their action, a petition that the Health Workers Union say has not been served to them.
As far as we are concerned, we haven't heard anything substantive to tell us that there is a court order.
But Uasin Gishu County Governor Jackson Mandagor is accusing public health workers of profiteering from the ongoing strike. He claims many of them are directing patients to their private clinics and has subsequently ordered all clinics in the county owned by the medics closed immediately. He has threatened to sack them all and replace them with fresh graduates.
Sisi tuko tayari kuajiri wafanyikazi wengine kama hao wataki. Na Mungu alani. Juzi wale wengine wamefuzu kutoka MTC, watu karibu 5,000. In this county we need only 300.
According to Health Cabinet Secretary, the medics will be served with a court order through the dailies tomorrow and they're expected to abide by it. And as the tussle continues, the main person bearing the brunt are Kenyans who cannot afford to pay for private hospitals. Njenga, Citizen TV, Nairobi.